Today I have my patient, Miss Catherine Flynn. She's 53 years old. She has angina pectoris, rheumatoid arthritis, and a history of syncope. She does experience some anxiety with the dental office, and her chief complaint is hot and cold sensitivity to her teeth, and she has a bruxer at night. Okay, Miss Catherine, I am going to lay you back and put some disease detecting liquid on your teeth. Okay. And I'm going to sit you up, and I am going to give you a mirror so you can see exactly what I'm talking about. So on your teeth, there are pinks and purples. As you can see, there's some on your lower front teeth, there's some in between your teeth, and what you're seeing is what we call biofilm. It's actually bacteria, or you can refer to it as plaque. You see some light pinks, which means that this plaque has not been there for that long. And you see some dark purples, which means that it's been sitting there for a while and it hasn't been removed at home. So I'm going to take your plaque index. Okay, I got that your plaque index was about a 40%, which is higher than we like to see. We like to see it under 10%. So whenever this plaque is not removed from your teeth, it actually builds layer upon layer upon layer. And if it's not removed at home, it can form what's called calculus. And calculus is the hardened plaque. And you cannot remove it at home. It can only be removed whenever you come to the dentist and somebody like your dental hygienist removes it, which is why we want to actually remove it at home before it turns into this calculus. And I'm going to teach you actually how to do that. So if this plaque is not removed, and it can get into the rest of your body, because the mouth is actually the entryway to the rest of your body, and it can start affecting your heart or other organs, and it can make you sick. So it is better to just remove this plaque at home while you can, so you can prevent yourself from getting sick. So as I was looking over your medication, I see that you take a couple medications that cause dry mouth. We call it xerostomia, but it's called dry mouth, or it's dry mouth. And that means that you're actually at a higher risk for decay, or what you probably know it as cavities. So your saliva actually acts as a lubrication in your mouth, and without it, the bacteria or this plaque actually has more surfaces in your mouth that it can adhere to. So it is a good thing that I see that you are using fluoride rinses. We're going to talk about that a little bit later, but I just wanted you to know that you are at a higher risk for cavities, so it is really important that you are taking good care of your mouth, and because you don't want to get all these cavities in your mouth. And so looking at your dental chart, you do have restorations in your mouth, you have amalgams, you have a couple composites, you have your bridges. These are also places that this plaque likes to hide, and it's a little harder to remove yourself. So that also makes a higher risk for calculus and cavities, things like that we talked about. That's not good. So I'm going to teach you how to remove it properly whenever I get into that with these restorations. And so whenever I did your intraoral exam, I did notice that on the backs of your front two teeth, there is some inflammation, and that is from your partial denture. If you need to make sure that you're removing your partial denture every night, because bacteria can actually get up under it and it just harbors on the roof of your mouth, and that's what causes this inflammation. So you need to take it out every night while you sleep, and you need to make sure that you are cleaning it properly. So there are such things as a denture brush that you can get to clean it with, and you can also get some powder or tablets that can clean it also. That's good to do. So you want to make sure that you're taking care of that. And do you remember during your exam whenever I was calling out different numbers to you? I was actually measuring the level between your tooth and your pocket. And that gives us a good indication of what's going on under where we can't see. And so you did have anywhere between 1 and 8 millimeters, which is a big gap, but we actually like to see 1 to 3 millimeters. That indicates to us that your mouth is healthy, your gums are healthy, this plaque is not getting into your gums. However, you do have some pockets that are greater than 3 millimeters. So that does indicate to us that you do have some disease going on. And if I jump over to your x-rays that we took, I do see some bone loss. So this indicates to us that we do have some disease going on. So we do want to address that. What that means is that this plaque is getting down into your gum line and is not being removed. And if it's not removed, it just keeps going down further and further, and it starts eating away at your bone, which has started happening to you. So unfortunately, the bone can't grow back. That's irreversible. But what we can do is plateau the disease, stop it from progressing even further. So we want to make sure that we're doing everything that we can to stop this plaque from getting down into your gums. So I also want to talk a little bit about looking into your habits history in general. I see that you are a bruxer, which means that you grind your teeth. So I'm going to recommend you to get a night guard that's going to keep you from grinding your teeth down at night whenever you're sleeping. And I want to talk about your oral hygiene habits a little bit. It is good that you're brushing your teeth, you're flossing, you're using fluoride rinses, and a rubber tip stimulator. However, I do want to talk about your techniques a little bit because I can help you maybe improve it just a little bit so this periodontal disease doesn't progress. Because if it keeps progressing, what's going to happen is your teeth are going to lose mobility and they can eventually fall out, which is what we ultimately want to prevent from happening. Okay, so can I have you show me how you brush your teeth? This is her brushing her teeth. Okay, so it is a good thing that you're brushing your teeth. However, I do want to help you a little bit more. So as you can see on the fronts of your teeth, your gum line is actually going up. It's receding. You have recession. And that is caused from you brushing your teeth so hard. So I am going to recommend to you an electric toothbrush because it is going to be a lot easier for you. One, because of your arthritis. It's going to be easier on your wrist. It doesn't involve as much movement. What you do is you simply say this is an electric toothbrush, place it, you're going to turn it on, the bristles are going to move, and all you have to do is go along your teeth. The toothbrush does the work for you. It's going to be a lot easier, especially with your, I see that you had shoulder surgery and your arthritis. It's going to be a lot easier for you, and it'll probably, right now, it may be hurting you to brush your teeth. It's going to definitely, what am I trying to say? I'm trying to think of the word. It's just going to make it a lot easier and more enjoyable for you. So however, electric toothbrushes, they can be a little bit of an investment. So if you can't afford one right now, that's okay. I'm going to recommend that you use an ultra soft toothbrush, and this is how you're going to want to brush your teeth. You want to start in the backs, and you want to angle your toothbrush up into your gum pocket, like this. You're going to wiggle back and forth about 10 times, and then you're gonna sweep down on your tooth. You're gonna insert it into your pocket about 10 times, sweep down. You're gonna do the same thing for the backs of those back teeth. Insert it up into that pocket 10 times, go back and forth, sweep down like this. However, whenever you get to the front of those teeth, you don't have much pocket to angle it up into. So what you're going to do is you're just gonna put it a little angled up onto your gum line. Do the same thing, back and forth 10 times, and sweep down. And then you're gonna go back over here to the backs. You're going to angle it up into the pocket 10 times, sweep down. Whenever you get to the backs of the front of your teeth, what you're going to do, is angle your toothbrush down like this, wiggle it, and still flick a little bit. It's probably gonna get your mirror a little dirty, but that's okay. And you're gonna do the same exact thing on the bottoms. Flick up, and here, place it on your gum line, go back and forth, flick up. So that is what I'm going to recommend you to do. And like I said, I recommend a power toothbrush or an electric toothbrush or an ultra soft if it's not doable to get an electric one right now. So now I am going to ask you to show me how you floss. Okay, that was good, but you know, it was a little rough, so that could also be contributing to your recession if you snap that floss down and your floss starts to move down. So I'm going to recommend you one of these. It's called a water flosser, and what it does is it just uses water pressure to get in between your teeth and a little into your gums, and it can help remove that biofilm. So all you do for this is also going to be good for your arthritis and your shoulder pain because it doesn't involve as much movement with the floss. All you do is fill it up with water and you just angle it into between each of your teeth like this. Super easy. However, that is a little bit of an investment too. So if that's not doable, I would recommend a floss pick. This is also going to be easier for your arthritis. All you do is put it down in between your teeth and go down like this a couple times. Go down into your teeth in the saw-like motion so it doesn't snap your gum line. And then you're going to go down into your gums and sweep up a few times. And this will be much easier on you. So for toothpaste, I actually do recommend you to use something for sensitive teeth, such as Sensodyne, because that is going to help you with the sensitivity to the hot and colds of your teeth. And then for mouthwash, I'm going to recommend you use Biotene, and that's going to help you with your dry mouth. And I do recommend that you follow these techniques that I showed you, the toothbrushing and the flossing, and we want to stop this periodontal disease from progressing even further. We just want to plateau it and stop it. And I think that if you're willing to do that and I help you along the way, then you're going to be right on the right track. Okay, thank you so much, Miss Catherine.